Hi everyone, my name is Edwin Pierre. I'm a proud Haitian American born and raised in Miami, Florida. My cultural roots have shaped my values around community, resilience, and compassion, all qualities that naturally drew me to nursing. I currently hold an associate's degree in nursing and work as a correctional nurse, primarily on the detox and psych observation units. I've been in this role for just over a year now, and I'm currently continuing my education in the RN to BSN program. One of the most rewarding parts of being in this program have been the chance to dive into evidence based practice and apply what I learned directly to work and all of the work that I do every day. I especially enjoy the simulation based assignments and the discussion boards, getting to meet my fellow classmates and better understand how they see things. This pushes me to think critically and reflect on my practice and learn from everyone and their diverse experiences. A concept that we recently explored that really stood out to me was the sacred cows in nursing. These are practices that have been passed down over time and are still widely used, even though there's little or no evidence to support them. One sacred cow that I've encountered in my practice is the routine installation of normal saline before endotracheal suctioning. It's been done for years under the belief that it helps loosen thick secretions and stimulates a cough, making suctioning more effective. But current evidence shows otherwise. In the article by Rowan titled Seven Evidence Based Practice Habits Putting Some Sacred Cows Out to Pasture, the authors discuss how about 30 to 40% of patients in hospitals receive care that is not consistent with current scientific evidence. They highlight how deeply ingrained traditions like normal saline installation can persist even when research proves they are either ineffective or potentially harmful. The research they reviewed found no improvement in oxygenation when saline was used before suctioning. In fact, in some studies, oxygen saturation actually dropped and then it returned to baseline for several minutes after the procedure. Not only does the practice fail to improve outcomes, but it may also increase the risk of hospital acquired infections. For example, contamination of saline vials during handling has been linked to bacterial spread, and instilling saline may actually flush bacteria deeper into the lungs. This practice was long seen as helpful, but studies have since shown that the saline doesn't even thin secretions. It simply mixes with them without breaking down the mucus. Experts now recommend systemic hydration and humidification as a more effective way to manage thick secretions. The second article that we read, Sacred Cows Gone to Pasture, it goes further by describing a large real world initiative that systemically evaluated and eliminated sacred cows in nursing practice. Their organization used the Iowa model of evidence based practice and Rogers' diffusion on innovations theory to guide the change. They created a 5 step process summarizing the evidence, auditing policies, surveying staff, grading performance, and setting priorities for change. One of the sacred cows they successfully addressed was normal saline installation during suctioning. I found it inspiring how their initiative not only changed policies but also shifted attitudes. Through education, engagement, and transparency, they built a culture that values evidence based practice. They saw major improvements like reduced catheter associated urinary tract infections and a rise in the use of evidence based practice like basinless bathing. The article emphasized that even top performing hospitals are not immune to sacred cows, and that evidence based practice requires ongoing evaluation, support from leadership, and buy-in from the bedside up. This really made me reflect on my own practices. In corrections nursing, we often inherit routines from predecessors, and that is a system that doesn't usually get updated as it should due to funding and what is available to us at these facilities, some of which may no longer reflect the best evidence when it comes to taking care of our patients. Reading these articles have motivated me to challenge tradition and ask, why do we do this? What does the evidence say? Thank you for listening, and I look forward to continuing this journey with all of you as we deep further into evidence-based practice and evidence-based nursing. Thank you.